and welcome to the call on African Renaissance TV with me, Sona Dabo. On this episode, we join the National Public Health Laboratory Services to celebrate the significant milestone they've recorded so far in the healthcare system, one that has promised to give us a medical diagnostic that would offer so much for our healthcare system in the country. Now, if you remember, we've gone through this process earlier when we came here to discuss the preparatory aspect and teams were built to go into the communities and do the needful. Now we're back here. Join us as we show you reactions from their collaborative efforts to make sure this list is finally out.
Independently from day one, when the entire issues started, we did the budget analysis, tracking of laboratory expenditures, in the country. And we must say that this is in line with a series of document development that we are doing in preparation for the national health, in preparation for the rollout of the national health insurance. We have our essential medicine list. We have our essential, essential healthcare service, service package. Now we are also having the National Essential Diagnostic List. Then this is also going to complement and will allow us to do our forecasting and our planning properly, listen to the needs of the health system. And in doing so, I've yesterday witnessed very interesting debates around service delivery up to the community level. The HMIS manager is here from day one. We are also developing a CHIS, that's the Community Health Information System, that will also speak with the essential healthcare service delivery package, and then also the diagnostic, the national diagnostic list as well, so that we have data from the community to the central level that will include both the service provided, the medicine, and as well as the diagnostic also provided. So we are happy to have this thing finalized so that the HMIS can have an all-inclusive package to make sure that we will not leave any data behind. Thank you very much.
Everybody, it's been 4 days, and I can say that we've done a good work, even if we do pat ourselves on the back. I'm really glad to have been involved in this process. And as we know, what we've done, as she said, is just the beginning. We now need to work this document that we've produced. And I'm particularly glad that everybody knows that the level of the health of a country is determined by its diagnostics, the labs and the imaging. The imaging is coming to the forefront now, and I'm sure that once we work this document properly, it will only be for the benefit of the entire populace, right from the primary level care to the tertiary level. Just to say that doing this list, we also need to think about the infrastructure and the personnel ramifications for the document. So let's keep that on our mind, and I'm sure the ministry and everybody that's involved will make sure that this comes up pari passu with the list that we've now developed, so that everything works seamlessly. And those that are supposed to man the equipment and the infrastructure required will be provided. Thank you very much, and congratulations to the Gambia.
Thank you very well, Professor. I think imaging is not, as we know in this country, it's not to the level we are expecting, but your contribution, I think, will reach to where we want to be. Thank you so much for being here. Next is Mr. Barrow. Maybe some of us don't know him. When we talk of the lab now, they are the roots of the laboratory services in this country. So I was fortunate to work with him, and he's still tired, but not tired. Mr. Barrow.
Thank you very much, Bababo, and everybody else involved in this program. It is part of a package that wants to enhance healthcare in the country, and we applaud the authorities involved in all of this. It's going to take us a level ahead. And specifically and particularly, I want to thank the Directorate of the National Health Lab for their foresight in thinking about all of these equipments and putting them in place. However, I want to remind everybody that this, as he says, is a package that involves a lot of background work to have it work seamlessly. In particular, for this to function and for it to have continuity, there has to be a well-trained cadre of biomedical engineers and application specialists. Without them, a lot of equipment that are around are very expensive, and they are from diverse places. There is probably no standardization. And they have a notorious history of frequent breakdowns, considering our weather, our environment, and dust and these things. If there is no focus on biomedical science and application science training, the continuity will be very difficult. And I haven't had it mentioned, but I'm sure there is a program for this. It's a key thing, it's a key part of it. The other thing is diagnosticians, our clients are the doctors. We have to find a way of communicating with them for them to know that tests are available, what they are for, and how frequently they have to be used. We really have to have a means of communication with the doctors and a survey of their level of satisfaction with our service. Otherwise, things will fail. And the bottom line is patient satisfaction. That is the end of it all. If the patients are not satisfied, whatever we have in as an input, it all becomes zero. So I hope we will all work together, taking all of this into consideration and ensuring that the National Health Package, National Health Service, move forward in the right direction. Thank you very much, and it's been great meeting all of you.
Thank you very much, Mr. Molo. I think the director, we have a young director, a young deputy director, and a lot of young scientists now. So I think they know where we want to be, and I think inshallah we'll be there. We will all join hands. Chief Scientist Paniba from Edward Francis Small.
Good afternoon. Thank you, Pababo. Like my colleagues have already mentioned, this exercise is a really, really needed one. And all of us, we managed to pull our socks up, and we'll work tirelessly to produce what I believe it's a very good document. And I'm hopeful that all that we have put in the document will be something that we will realize and make very good use of it. However, I have only one thing to emphasize on, and that is when we have all of these machines, all of this reagent in the system, we definitely need trained and skillful scientists. So I will urge the Directorate of the National Health Laboratory Services to look into this, that all of these centers, especially the district hospitals and the major health centers, we have well-trained, rounded scientists posted in these areas so that we can have what we desired at the end of the day, which is good clinical outcomes or good clinical management of patients. Yes, at this time in the system we do have trained scientists, but majority of them were trained few months and then left into the system, let out into the system. So I think it would be good to have them back and be trained, and those who are, who have been in the system for a long time, they also would benefit from training with these new technologies. I will want to take this opportunity to thank everyone for your contribution to this document, and I'm really, really hopeful that the progress of the laboratory service that we all want, we will achieve that, inshallah. Thank you.
Thank you very much. So my first thing is to congratulate you. The Gambia is the 6th country in the world to have an EDL. So today you became, so well done, and forward and to make sure that it is a reality in the health system in the country. And, alongside that, it's very important to put emphasis on the foundations that need to be built. And based on all of the reports that were presented on the first day, one thing, what's really important is that the country implements the legislation which will set up the review bodies and regulatory bodies that can do certification of professional staff and can do lab accreditation and can manage and really raise the quality of service in this country and lay those foundations. And so in parallel with this first EDL, that's a really important set of activities that I hope you will prioritize and take forward. And alongside that, building up the logistics and central medical stores and distribution infrastructure required to ensure that you don't have stoppages related to stockouts of reagents and so on. So I really want to encourage you that alongside this first document, that those foundations get laid so that 5 years from now, if I have the privilege to come back to the Gambia, I will see that you have all of those things in place, and alongside that, an excellent laboratory and imaging service in the country. So I want to congratulate you again, and I want to say that it's been a personal pleasure for me coming. This is the first time to West Africa for me, and I really had no idea what to expect, and I found it a very warm and personally enjoyable experience. So thank you very much for welcoming me the way you did, and also I think I can say that for Ezekiel as well. And so I think that I hope that FIND will continue to collaborate with you going forward, and I wish you everything of the best and success for the future.
Thank you. That's my title, huh? Anyway, I'm glad that I'm part of this. Just to say, I don't know how I get married with Public Health Lab since 2021. When I see a call from Sirifo, those days when I see a call from him, I know he needs something. Now I know his plans. 1, 2 or 3 weeks before the event, he will pretend to call me and say, "Nkejibele." But I know that there is something near coming. He needs something. And sometimes he will push others. But I think it was very enjoying to work with them since the start of their strategic plan. And one of the things I noticed was the enthusiasm amongst the new breed of lab staff that we have. I think you have something special which you might not cherish. That you are, just like Faba said, you are all within the same age bracket. And when you are in the same age bracket, it's easy to interact and influence each other. And I think you should capitalize on that to move forward, so that you will be in the history books of this country in terms of laboratory services. The other thing I just want to dwell in is the way forward. As somebody who has served at policy level, one of the things you must get, one stage is that we agree here, but you must let people buy into it. And that is the top level people. You must work closely with the Office of the Director of Health Services to get things going. As the custodian of health services, you are making their work easy. And collaborate, interact for the best interests of the achievements you want to attain. And the other thing which we always don't value much is how do we get to involve those who allocate the resources to be aware of these documents. We are here, this hall is full of staff of the Minister of Health and all those on health, isn't it? But it's not us who allocate the resources. There are people who are somewhere in another planet. You need to get them be aware of this and put across why this document is important, how it can transform the lives of the people. Those people, when they are aware of it, I think when they are allocating resources, they will be sensitive to the existence of this document. As alluded to by the other speakers, that it will be, we are going to be measured not the document, but how much we have implemented in this document. And I think that should be the spirit, so that we to work together to achieve it. let's involve also the National Assembly, which I am saying those are the ones who allocate the resources. Before the ministry give you what you have, they must have something from the National Assembly that is legislated for laboratory services. We are too much dependent on donors. It will not work. You cannot beat your chair, you cannot run your compound through begging. We need to allocate resources for laboratory services. I think all ministries have they're all important, but health is very important. That before you run your other ministry, you must first be healthy. And I think we should be putting on those things. Once again, I thank all of you, especially the consultants who travel all the way to come to Gambia. It might not be the best time to visit the Gambia because of the rains, but I know in 2 months' time, if you come here, you might not, you wish to lose your flight so that you stay longer. So we wish you a safe trip back home. I think this is not the last we may be interacting, and we'll be more than happy to interact with you. Thank you very much.
Thank you very much, Mr. Babu. Good afternoon to you all. I will start saying that today I'm very, very delighted and happy because we have completed one of the major requirements of quality laboratory service delivery in this country. Because the main aim for the National Essential Diagnostic List is basically to make laboratory service delivery accessible, quality for that matter, accessible to every Gambian at different levels. And we've all seen that the document has designated different services at different stages, and which will go a long way in making laboratory service delivery accessible to the people that are in the rural areas as well as in the urban areas. This list has been developed through vigorous data collection. I think presentations were made during the first day, which shows you, all of us, that we don't sit down and put things as because we think that they should be there. The process started since February 2023, and then teams have gone out, spent almost 20 days in the field, 25 days in the field, 10 days in the field, trying to collect data. And then we've seen that the data collection was segregated into different groups based on specialty, and then data were collected across the country. And it is that data that has been used to develop the National Essential Diagnostic List. So this document is showing us actually what is existing in reality in our country. And then based on that, all of us put our thinking together and then review the draft that has been done by a consultant from FINE to suit the needs of the Gambian people. So I will congratulate and I will thank all of you for putting your support to make sure that this document is reviewed and this document is taken to a next level or validated for laboratory essential diagnostic delivery in this country. I think I will not do justice if I don't recognize the contribution of the National Public Health Laboratory staff, because all this data collection, they were there. And then together with other healthcare service delivery across the country. We have doctors in this data collection. We have imaging experts in the data collection. We have nurses contributed in the data collection. So it was a cross-sectional contribution. Even the pharmacists were part of the group that went out to collect data. Because we did that because we want every and each healthcare service delivery to contribute to this document, to make sure that we have a comprehensive document that go across all the healthcare service delivery sector. I will not say much, but I think I also would like to appreciate the contribution of all of you, especially people like Dr. Mamadi Cham, Doctor has been with us since 2020. And then all the documents that we have developed for the laboratory, he is always with us from day one up to the end of the development of the document. We've developed the policy with him. We've developed the strategic plan, and all other documents that we've developed, he was part of it. So we will thank him very much for his contribution, and we look forward for more from him to contribute to some of the documents that we will develop in the near future. I would also like to thank Dr. Barrow, Mr. Barrow from Health Screen Diagnostic. You know that he has retired. He is a private practitioner, but he always answers to our call. Anytime we call him, he will leave all his busy schedules and come and make his contribution into this document. Mr. Barrow, we thank you very much, and we look forward to tap more skills and more knowledge from you so that we can make laboratory service delivery in this country to the level that we would want it to be. I will not say much, but to end, I will say for you to understand that this activity is funded by FINE. FINE is Foundation of Innovative New Diagnostic. They are our long-term partners, and they have contributed. They support or funded all the documents almost that we have developed in this country. They funded the development of the policy and the strategy plan. They funded the establishment of COVID RDT in this country. And then they are FINE also funded this activity that we are doing. They funded the development of essential diagnostic list. And then they provided funds, they provide the expert consultant to work with us. Those who were here since the beginning of the development of the document, we know that a consultant that provided the initial input into the document is different from what we have now. So FINE is very supportive, and then they want us to get to a next level. So we can't forget them, and then we will continue to pray for them to get more funds, and then to also support us more in the near future for us to develop more of our documents. Ezekiel and Lucy, we will extend our appreciation. We would like you to extend our appreciation and our gratitude to the rest of the FINE members, especially KK, that we appreciate all the contributions that we have received from you. And then we look forward to have more collaboration and more support from you so that we can take the laboratory service delivery to the next level. As the other speakers said, now we have the essential diagnostic list. The next level is how are we going to implement it? And when are we going to implement it? So the next step that we'll take is we will soon work on the development of the implementation plan. This will be developed, and then once the implementation plan is developed, we'll go extra mile to make sure that it is also costed as we did for the strategic plan, so that we'll share this with partners, we'll share this with the government, so that we know where the government can come in to support us for the implementation of the document. We will continue to do the advocacy. We will continue to knock at doors of people who we feel that can help us to take this, the implementation of this document to the level that we want. Even those who are sitting here, we know where they can go. Dr. Chan will not leave you. We will still knock at your door. We know that you can lead us to where we can fix things to make sure that the implementation is done. So we will try to, we will not leave you. We will continue to get as much as we can from you. And we will also give you what you need from us. So that is give and take. Right. Once again, thank you very much. As I said, I'm very, very happy, and I appreciate all the efforts that you people put. I appreciate your attendance in this room since the first day up to today. Once again, thank you very much, and we look forward to have a very good implementation of the document in this country. Thank you very much.
Good afternoon. I don't think I really have anything to say after all these eloquent speakers gave their remarks. And most of them are my mentors. I'm learning a lot from them. So again, we are glad to be part of this process. It has been a very productive one, I must say. And again, I'll join everyone to thank all of us for doing this for the Gambia and the Gambian people. Just the fact that the room is full today on a Saturday, muddy day, it just shows that everyone is really committed to this. And the implementation, the Office of the Director of Health Services will make sure that we continue working with the National Public Health Lab to make this a success. It wouldn't gather dust somewhere. We'll all work together to make sure that we get the best for the country. The Gambian population deserves it, and we are all committed to ensuring that we get this done. During some of the discussions, the group discussions, I had to make consultations, even though my seniors are not around there attending the UN General Assembly, just because of how much they want this as a success. They decided to respond to my call, and then they gave input. So some of the things I was putting across as suggestions were not my own ideas. They came from the most senior people in the Ministry of Health. So we'll ensure that this continues. And again, I want to thank everyone for giving it your all. And on behalf of the senior management of the Ministry of Health, I want to declare this 4-day workshop officially closed. Thank you.
Okay, so we have been joined by the Deputy Director of Health Services, Dr. Fatmata Diba. Dr. Fatmata Diba will tell us her impression so far from the perspective of the ministry on how this diagnostics list will be used by the country.
Thank you. I'm really glad to be part of this process. And from the beginning, when we started this workshop, we have been very happy because the aim of the Ministry of Health is to ensure that no one is left behind when it comes to accessing quality healthcare in the country. So taking the diagnostic services up to the lowest level within the tier of the health system is something we are really glad to be a part of, because at the end of the day, we want to ensure that we strengthen primary health care. Strengthening primary health care will help the country to attain universal health coverage, which is what we want as a country. So having an essential diagnostic list will ensure that people get to receive tests at the point of care. So you don't need to come all the way to the teaching hospital to get certain tests done for you. So having this diagnostic list will guide us as a country as to what type of services can be rendered, and making sure that when the patients go to the health facilities, it's like a one-stop center for them. That is the aim, and that is what we want to ensure that we achieve. So having this is one way of helping us as a country and as a ministry to ensure that we achieve that.
So what is going to be the take-home message for the people that are watching you right now?
The take-home message I'll say to Gambians is, let's take ownership of our own health and let's support the ministry. Let's make use of the services that are available. We shouldn't sit and wait till we are sick, really sick, to go to the health facilities. Whenever we feel unwell or we feel a change in our bodies, go to the nearest health facility and then get the support. Sometimes it's better you go to the facility and you are told that this is nothing to worry about than sit at home and wait till it gets worse. By the time you get to the facility, it may be too late. So again, my word would be, let's take ownership of our health and make sure that we seek for care at the earliest possible time.
Thank you so much, Dr. Diba. Thank you. She just said we need to take responsibility of our own health. Let's get to see more reactions from the participants of this review and validation process. Okay, we are also joined by the Director of National Public Health Laboratory Services, Dr. Jan. We know that this must be a good moment for you. Starting from February, you've been going up and down to make sure the National Essential Diagnostic List is provided in the Gambia. Being the 6 countries so far that have gotten this list, how do you feel today?
Yeah, I feel very much delighted and happy today to see that the Gambia has developed the National Essential Diagnostic List and validated it. So I'm very much happy today. I think I'm the happiest person in the Gambia today. Yeah.
This is nice. And then, so what is the way forward? And how, basically, before the way forward, how was the whole process? Because we know that teams were up in the country to make sure they get their research done and collect data. How was this process so far?
Yeah, so the process started since February to now, and then the process involves segregating the people who are going to develop the document into 6 different groups, all the different facilities, based on the checklist that they have to collect data for us to develop the NEDL. So after the collection of the data, we compile the data, the different groups compile their data, and also prepare a report as to what they have seen and what are some of the recommendations that they put forward. So that was the process that we took to develop. Then after we had the report, then we shared the report with the consultant, and the consultant now drafted the NEDL based on the report, the data that we collected, and the report that we have provided for her.
This was such a rigorous process. So what is the way forward so far?
So now the way forward is for us to prepare what we call an implementation plan. We need to make a plan to show how we are going to implement the National Essential Diagnostic List. We will prepare the implementation plan, and hopefully next week, we want to start the next week. After the preparation of the implementation plan, then we will do the costing of the implementation plan, so that anybody who wants to chip in can look at what area you feel that you can work on that, and then you know how much it will cost for you to implement, for you to help us to implement that section.
Nice. So we want to say congratulations to you and your team for coming this far with this initiative, and we are wishing you all the best. Thank you very much, sir. All right. So we do know that Foundation for Innovations and New Diagnostics funded this whole process, and you are from there. So tell us your impression so far from February till now. Have you achieved your outcomes for funding this project?
Yes, it's been a great pleasure for us at FIND to be supporting the Gambia in developing this very important technical policy document for improving diagnostics access in the country. And we see this as the first, important step to achieving that vision for the country. And the next major step now is taking action to implement this important document across the entire country. So we hope that, with all the various organizations and experts, all the various partners will work in a concerted effort. Hopefully we will also contribute to that process as well at FIND to ensure that we get to that final destination that we want the country to get to. And
thank you so much. So, Lucy, you've traveled all the way to West Africa, Gambia to be precise, for the first time. Tell us your impression.
Well, I had no idea what to expect when I came to West Africa, and I must say I've been really very impressed, especially with the diagnostics, the people in this room. I mean, I've been amazed at the level of passion and the level of commitment. I have not seen a country where people really came every day, all day. They did hard work, and they stayed even on Saturday to lunchtime. Not one person left, and the discussion was very passionate and animated, I want to say. So I was really impressed and very, what can I say, it was very personally satisfying for me to be part of a project like that.
Nice. So what would you want to say to the viewers?
Well, your representatives and who work in the Ministry of Health are doing all this important work to improve the healthcare of the country, improve your access to diagnostics. So we hope that you will benefit, you will reap the fruits of all of this labor of love that these important experts and officials of the country, all the efforts that they've put into, getting this process done. So, I hope that they will also benefit from all of this in the nearest future, hopefully.
Thank you. So a quick one, Lucy. What will you tell FIND if you go back?
I will thank them for allowing me to be part of this project, and I'll tell them that Gambia is an amazing country, and that the good opportunity that you have in the Gambia is that the project is achievable. You're not dealing with a $200 million person population where it's a really big project which takes a huge effort to get there. So this is really doable, and I hope that they will continue to support you.
All right, thank you so much, and thank you.
Thank you.
All right, viewers, this has marked the end of our beautiful episode on the review and validation process of the National Essential Diagnostic List that was organized by the National Public Health Laboratory Services. I've been your host, Sona Dabo, and this is The Call on African Renaissance TV. Until we come your way again, please do subscribe to all our channels and like and also share our videos for more interesting episodes that will come your way on African Renaissance TV. Bye from us.